project one slide, coronary artery disease.
Yes, sir.
Okay. So here we'll know about some pathophysiology and some clinical recognition, which is in the form of signs and symptoms. Okay. What is coronary artery disease? So here we let's know that this is the most common form of heart disease in all over the world. Okay, we need to understand that coronary artery disease is the most common heart disease. Okay, and in this disease, the coronary artery becomes narrow. What happens? The coronary artery, which is the one of the blood vessels which supply blood to the heart muscles, that is a coronary artery, and this coronary artery becomes narrow caused by atherosclerosis, right? uh, it prevents, when it becomes narrow, it prevents adequate blood supply to the heart muscle. We need to understand that coronary artery once become narrow, it prevents what? Supply of blood to the heart muscles, or it may slow down the, or it will not supply adequate blood, we can say. It prevents adequate blood supply to the heart muscles. Okay. uh, then next is it may progress to the point, like the narrowing process may progress to the point where the heart muscle is damaged due to the lack of blood supply, right? So this becomes severe. Okay, and the severe, the point is where the heart muscle become damaged due to the blood supply. Okay, so at the point where there is no blood supply so to the heart muscles, and because of that the heart muscle cells will not get blood, will not get oxygen, will not get nutrients, and because of that heart cells will die, and that is what we call it as a heart muscle will damage. Okay, so when there is a cell death, so the cell death is a the what we say the damage of the heart muscles. Okay, so such damage may result in infarction, arrhythmias, and heart failure, right? So here infarction is something like obstruction of blood supply. So when blood supply will be obstructed. Okay, so obstruction of blood supply to an organ or region of tissue, typically by a thrombus or embolus, causing local death of the tissue. So this is infarction. Infarction may occur because of the coronary artery, which has become narrow, caused by atherosclerosis. So that narrowing, okay, further can obstruct, okay, the blood supply to an organ. So it's a condition of the severe atherosclerosis. So where there is a obstruction of blood supply to the heart tissues, and sometimes this obstruction of the blood supply may be because of a thrombus or embolus. Okay, so thrombus or embolus is something where it's like clot like formation in the blood. Okay, so it may can occlude, it may can uh, uh, obstruct the blood supply when it comes into the coronary artery. So it causes local death of the tissues. So there is a local death of the heart muscle tissues, and finally we have to understand this abnormal condition as a medical term as an infarction. So that changes in the heart muscles usually called as an infarction. What is arrhythmias? Arrhythmias is a also called as a irregular heartbeat. So this coronary artery changes in the coronary artery also leads to arrhythmias, which is a irregular heartbeat, and there is some heart failure also, where the heart muscle doesn't pump adequate blood to the body. So this is what it leads to heart failure. So coronary artery also lead to heart failure because of the heart muscle does not get adequate blood supply. Okay, and because of that the heart muscle will deprive of oxygen, nutrients, muscle, and the other required materials So heart muscles become weaker and will not be able to pump the adequate blood to the body, and we consider this situation as a heart failure, right? Now, coronary artery disease, the pathophysiology is this coronary artery disease, which is CAD, we usually know as a small abbreviation, and this is also called as a atherosclerotic cardiovascular disease or coronary atherosclerosis, coronary heart disease, or ischemic heart disease. So there are different name or nomenclature of this particular disease, right? Uh, in most cases, the death occurs within 1 hour of the start of the symptoms and before the person reaches the hospital. So what happens? The death may occur when there is a coronary artery disease. So it's what the death may occur within 1 hour of the start of the symptoms or before the person reaches to the hospital. So this is what observed in most of the coronary artery disease cases. The major cause of this coronary artery is what we have to understand is atherosclerosis, which means deposit of cholesterol and lipid in the coronary artery disease. Okay, or any atherosclerosis is a medical term which is defined as a deposition of cholesterol and lipids in the blood vessels. Okay, and if the atherosclerosis takes place in the coronary artery disease, so we call it as a coronary atherosclerosis. Okay, and the coronary atherosclerosis defined as an abnormal accumulation of lipid or fatty substance or fatty atheroma, also called as a plaque, okay, in the lumen of coronary artery. So in the lumen of coronary artery, okay, in the intima layer, okay, you have to understand that we have a different layer of layer in the coronary artery, intima, media, and then the last one is what we say. क्या होता है लास्ट वाला क्या होता है लास्ट वाला क्या होता है इंटीमा हो गया जो कि जो इनर लेयर है, मीडिया मसल लेयर है, और लास्ट में जो हमने जो लेयर पढ़ा है वो जो एक्सटर्नल लेयर होता है वो 3 लेयर होता है और इंटरनल लेयर there is a deposition of lipid and fatty substances, and this deposition is sometimes called as a fatty atheroma or plaque, and if it occurs in the lumen of the coronary artery, then we call it as a coronary atherosclerosis. What are the risk factor of the CAD? What are the risk factor? So CAD, coronary artery disease, the risk factor is the main is there are two types of risk factor. One is unmodifiable, and the second is a modifiable. So unmodifiable is a age. We cannot modify the age, gender, ethnicity, genetic defect, or family history. So this is unmodifiable. It's inherent. What we say. We cannot change the gender. We cannot change the age. Now modifiable factor is a like dyslipidemia, where there is an increased level of serum lipids, hypertension, that is increased blood pressure, cigarette smoking, obesity, which can be visceral obesity or central obesity, or physical inactivity or sedentary lifestyle. So these are the risk factors which can be modified by the person who are suffering or who have a risk of coronary artery disease. Okay, so there is a modifiable risk and unmodifiable risk, and one of the major modifiable factor is a physical inactivity. So a person who have a physical inactivity can be modified. Okay, here modifiable one of the modifiable contributing factor is a diabetes mellitus, stressful lifestyle. So two factors which contribute in the development of coronary artery disease. One is the diabetes mellitus. Person suffering from diabetes mellitus usually may progress into the coronary artery disease. Okay, so those who are diabetes mellitus, so unmanaged, untreated diabetes mellitus, slowly and slowly progress into the development of coronary artery disease. Or the person who have a stressful lifestyle, so those person are more susceptible to get a coronary artery disease. Okay, so and also the major modifiable factor is a physical inactivity, where the person should have you know uh, active lifestyle. So if the physical activity is changed, okay, and then we can also reverse the process, or we can decrease the risk of getting coronary artery disease. This is what may be due to genetic inheritance. Here we have done the start over here. So the start indicate that like elevated serum lipids, it may be inheritance. Hypertension may be inheritance factor, right? Are you getting my voice? Hello.
Yes, sir.
Yes, sir.
So, these are the metabolic syndrome. Sometimes metabolic syndrome can also leads to coronary artery disease. What is metabolic syndrome? Metabolic syndrome is a syndrome is a group of disorder. Okay, group of disorder, and here it's a metabolic type where it's because of abnormal metabolite present in our body. Okay, abnormal level of metabolite. So metabolic syndrome, it's not a single metabolite, it's a group of metabolites which may lead to development of coronary artery disease. So these are, you can see, insulin resistance. So if a person has an insulin resistance, if a person has a hyperglycemia, that is the blood glucose level is more than 110 mg per dl, or if there is hypertension, that is the blood pressure is more than 130 by 85, and if there is an increased triglycerides value is above 110 mg per dl, or if there is a decreased level of SDL in men, approximately less than 40 in men and less than 50 in women, and if there is central obesity, and if there is a, the main, the waist is more than 40 inch, and in women the waist is more than 35 inch. So these are the, the group of, metabolites or group of changes which takes place, and we call it as a metabolic syndrome. And this group of uh, 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 group of changes in our body because of the variation in the metabolic levels, okay, metabolites in the blood or in the body. So it leads to metabolic syndrome, and this metabolic syndrome can increase the risk of coronary artery disease. What is atherosclerosis? So here there is elevated serum lipids. When we do the lipid test in the blood, so it's usually the value is higher side. So we can see the cholesterol level is more than 200 mg per dl. Triglyceride level is more than 200 mg per dl. HDL is less than 35 mg per dl. So it calls, if the value is less than 35, so we call it as a major risk. If the value becomes if the HDL value becomes 45 to 59, it's average risk, and if the value is more than 60, so there is a negative risk. There is no risk. So SDL value more than 60 mg per dl, so there is no risk of atherosclerosis or coronary artery disease. But if the value is less than 35 mg per dl, so there is a major risk of developing atherosclerosis, which progressing to the coronary artery disease. Now, next test is LDL, where the value less than 130 is desirable, it's good. But when the value is between 130 to 159, the risk is one borderline. But and the last one, the value is more than 160 mg per dl, so the value the risk is very high. So LDL value more than 160 is very high. LDL value less than SDL value less than 35 is having a major risk, and this cholesterol and triglyceride level more than 200 mg per day also increases. Okay, the risk of developing atherosclerosis and coronary artery disease. These three things you have to understand. The CAD death, the means the death due to coronary artery disease, may increases in men who smoke, who have diastolic blood pressure more than 90, and total cholesterol level more than 250 mg per day. So this, these are the actual risk which may can when all the three risk factors are added. So this can increase the chances of for developing coronary artery disease, and also for getting death. So this is what we studied about the coronary artery disease. Now to this lecture, this slide, if you have any question, you may can ask me, because we are near to the end of the not end of the class. Time is about to over. Yeah, is there any question?